Yeah, I feel like, nodules and incidental findings, it almost feels like there's some diseases that are most often found incidentally
Yeah.
when we do certain things. I'm kind of wondering just with recommendations and things like that when people do things like CAT scans and MRIs. Do you see a way to kind of maybe potentially build into the process the ability to find things that are more likely to be incidental? Like, have you thought about that at all? Because it doesn't seem like there's a real solid fix for it, because some of these things are only found incidentally and their symptoms often overlap. Like, what are your thoughts or musings on how we can kind of pinpoint things that are usually only found incidentally?
Yeah. So yeah, that again, the awareness, multidisciplinary approach, the provider between the patient and provider, the symptoms. But again, some people like have very overlapping syndrome that I agree. And in that case, I would say like everything incidental that we find because of the increasing advancement in technology, we have now multiple like advanced technology that are finding this incidental finding and eventually getting them diagnosed. I would say should start from the primary care providers clinic, their yearly screening, their regular follow up, annual exam. I would say this is very important. There are patients in the community, they didn't see their primary care in last 3 to 5 years last. So I would say regular annual follow up with your primary care can make a difference.
Wow, yeah, that primary care visit is seems to be
Yeah.
the first point of contact for so many things and opportunities. Is there anything else that you're excited about with either one of these studies that we haven't covered so far?
Yeah, I'm excited about getting more pheochromocytoma and following up and finding out the genetic correlation, how much they are related, or are they more sporadic or more genetic? Yeah, looking
Interesting.
forward for more.
Yeah, and I'm wondering just from just the landscape of what we know already, is this kind of something that's passed on from the maternal or paternal side, or is it, do both parents kind of have to have the gene? Like, what do we know so far about maybe some of the genetic aspects?
Yeah, it could be like it doesn't need to be both of the parents. It could be autosomal dominant, meaning if one parent have it, the other like offspring can have it. So that's why the genetic counseling and genetic testing is very important at the diagnosis.
Hmm. And then, just based on what we know so far, is this something that people can be tested for even if they don't present with the illness, or?
For the genetic testing,
Hmm.
you mean? Genetic testing is very expensive. It's not easy to get, but I would not say that everybody should be screened for genetic testing. That would be like huge burden in the economy of United States. So I would not suggest genetic testing for each and every single person. But definitely, if the primary care provider visit, they had like new onset of hypertension, new onset of palpitation, new onset of some chest pain, or excessive sweating, something is wrong. These are the more areas I want everybody to be aware of, and maybe those kind of people like young patient, all of a sudden hypertensive and like fluctuating hypertension, fluctuating palpitation, chest pain. The primary care provider, they can give a diary, like they can maintain their notes, which days he was like getting symptoms and did he check his blood pressure on that day. That would be amazing. That would be easier to screen who needs further testing and who doesn't.